This video is on medications. So when you're adding a medication, it's good practice to be in a consultation. So we'll just add another tab on. So we're going to do his medication. This is the screen that you get up. So the first thing you see, allergies will be listed here on this tab. If you did want to look at the current medicines, past medicines, any problems, you can just click on the different tabs, but that's the one it comes up to as standard. And then let's say, for example, I'm going to give this gentleman trimethoprim because I've forgotten he's got an allergy. You start typing and then the options come up. So this gentleman we're going to give him. And then you can see you will get a pop-up saying, oh, you've got an allergy to this. Okay, whoops, don't choose that drug. And it also tells you right there. So let's now change him to nitrofurantoin. So start typing and it automatically comes up. And then you're going to click on, that's the one we want. The black ones are Emis self-populated. The blue ones are anything that I have added on in the past. And if you don't want them anymore, you can just remove them. So he's a gentleman, so if he had a UTI, he would have a week's worth, so we'd put him on that. You could choose whether it's acute or repeat dispensing, but I'd say as a trainee, don't go near repeat dispensing, talk to your trainer before you do anything like that. But acute and repeats, if you were going to put it on repeat, you'd have to say how many you wanted to give him. Is it a variable repeat one, or is it a regular one? But this is an acute item. You have also got these optional prescription information. So a pharmacy information will go on the green side of a prescription. So a pharmacist and a patient can easily see it. The patient info only goes on the right hand side on the retainer slip, so it's a bit easier to miss. But it's good for any information. So I might put on here, say for example I was giving him something that needed monitoring. I might say annual bloods due in July or whatever it is I want to put in there. If I wanted to say do not take with simvastatin or whatever, I could write that here. So I can just add a message on there, or I could do it here. So this has just come up because I've changed this. The computer doesn't know that 1 to be twice a day. It can't do the maths, so it's trying to ask you. So you would say you get through 2 per day, and then it remember that if I ever did that instruction again, that it meant for 2 a day. So I'm just going to ignore that just because I've played around with it. So you could write whatever text you wanted to there or in there. You can click on this, the pack details. So if you double click that, it tells you how much all the drugs cost, which is really helpful when you're trying to see which one of very similar items are actually the cheapest. So you could say, okay, so the 14 capsules for £9.50. What other options did I have here? So I had, have we got a liquid? There we go. So how much is nitrofurantoin as a liquid? Well, firstly, this has come up to say, do you really want to prescribe that? Then you'd say, yeah, because you can see here, it is £457. So it's useful to be able to see how much they cost, but also the pack sizes. There's no point prescribing this as 280 mils because it comes in a pack of 300. So you'd click on 300 and that would populate that one for you. I'm going to go back to the more usual capsules. Go back to that button. Just delete that text there. So this would be how I would do this as an example. If I had something else to add, I could click add another. So we shouldn't be prescribing paracetamol. It's over the counter, but as an example, I'm just adding that on. And I could issue later, and it will go on to the notes but not issue, or I could issue straight away. So if we clicked issue later, you would see that it comes up onto the section in the notes. And if you click on medication, it is also here with your name on. So we have paracetamol and nitrofurantoin. You could then highlight them both and click issue. So because he's a test patient, he's not EPS, which is electronic prescription service. The vast majority of our patients will be electronic and they'll be set up for a chemist. So it's worth sitting with your trainer and actually watching a live prescription, because we would send this electronically where we'd put our PIN code in for our smart card, and you could change it to different pharmacies, but I can't do any of that on this test patient. You would approve and complete it, then you'd put your smart card PIN in and it would send it electronically. If there is ever a problem, you could approve and complete and it would come out on my printer as a paper script. I'll cancel that. When you're in your medication screen, when you were both issuing the drug, you can add drug on again here. So let's say I'm going to give him the paracetamol again. First of all, it will tell me you've got a duplication because I've done it twice, but I'm just going to use this just to show you. You can also click on this button here, drug information, and this is really handy. This is the BNF. So you could say, well, what's the indications? What's the dose? I can't remember. Back to top, or what's the pregnancy bit? And it'll take the full BNF section per drug is on that button there. You've also, if you want to see, if you right click on any item, you could issue it, you can reauthorize it, you can reprint it, you can edit, you could replace it. So say for example he came back and had an allergy to that, I'd mark it as an allergy and I'd replace it with the right drug so you can see the audit trail. And if you're ever ending a drug, you must put in the reason why so we know in the future what happened. The same if you were replacing it, it's a really useful thing to do because you can see it really clearly on the system. So if I went down, we're going to give him some Kefalex, so I'm going to issue that later. Oops, so that's exactly what I want to show you. You must put the issue in. So you got to do, I don't know, if it's an adverse reaction, you can then officially put the allergy status in. If it's just because you're doing other things like change of strength, you could then issue it. And then when you look at the consultation, it'll clearly show you here that this medication has been replaced. So it's a really helpful thing to do so everyone can clearly see why a medicine was replaced. It's also really handy because you can look at past drugs and see why they were stopped. So this is the current issue. If you click on this button here, so current to past, it takes you to everything that they had previously, and you can see here that reason I put a change of strength is here. So if you need to quickly look back and see, oh, why did that patient stop Bramipril? Oh, not very helpful here. It's just expired. So we've got no idea if that's because he had an allergy, it's just because he never came back to us. Whereas people who actually put a reason for why it stopped, it's dead easy, a quick glance, oh, we just changed the strength, whatever, it's fine. So it's a really important thing to put the reason you're stopping or replacing. You can also see all the drugs this man has ever been issued. This is set up in chronological order for myself because I think that's easiest for me to look at. You can change that order, so you can go on to this button here. You could say Emis drug group, so I'd say the most common things that I want that one first because that gives me in chronological order. Then I go into drug group. So for example, if I have somebody who's got atrial fibrillation, I want to see what cardiac drugs they've had, do that, and then all the cardio drugs are there. I do that a lot for diabetes, so say I want to see how many different type of drugs they've had so far, I click on that, go down to chapter 6 and all the diabetic drugs would be listed there. And then if you want to go back to the current list, click that button and you go back again. You can also see that the medication review is coming up to due, so if you want to do a medicine review, you click on that button. This is without a patient. Then the next pop-up is about how we get paid for structured medication reviews, and this is aimed at clinical pharmacists, so you're not doing a structured medical review, so just going to click no. And then that has brought his medication review, and like you can then add in your consultation whatever you want to say about that medicine review. You would then need to reauthorize these drugs. For example, if you're doing a proper medication review on a normal patient, and you would click that button. And if you want, the standard policy is to reauthorize for things for 12 months and to have things on as 2-month supply. So if this was a kind of normal patient, you would click 6 and reauthorize all, and that would in theory put everything to 12 months supply. This is just saying because you haven't looked at all 12 things, are you sure you want to reauthorize them all? Well, yes, because I looked at them before I click the button. Then click OK, then you'll see these 1 of 6 will all be cut, have all gone down to 0 of 6. They've all been reauthorised for 6 issues. You can do the screen message, which is this bit down here. So we can change that to whatever we want to use. So you can delete it. And it's a really, helpful thing to add on little messages, and that is your overview on medications.